again, this is Catherine Bauma once again with another video here on some information about drugs for the first drug card test that we're having this semester here. In this show that I'll be doing, it's about the top 25 drugs, kind of the next tier of information that we'll need to know, including the FDA indications, dosage forms, and strengths. So let's get started. First drug, again, is levothyroxine sodium. The FDA indications are replacement therapy for reduced or absent thyroid function of any etiology, and myxedema, coma, or stupor without severe heart disease. Do not add any other intravenous fluids. And by the way, in case you were wondering what indications means, it just basically means, what is this drug used for? Just in one word. Okay, so dosage forms and strengths. In the tablet form of this medication, there's 25 microgram, 50 microgram, 75 microgram, 88 microgram, 100 microgram, 112 microgram, 125 microgram, 137 microgram, 150 microgram, 175 microgram, 200 microgram, and 300 microgram. For the injection, there's 200 microgram and 500 microgram per vial. And by the way, if I mispronounce any of these diseases throughout this show, I do apologize. I'm going to try my best to sound them out, but some of these I'm not familiar with. So I am looking into them just so I'm more familiar with what some of these diseases are. Okay, second drug here is hydrocodone bitartrate with acetaminophen. The indications are for the relief of moderately severe pain. And just as an extra note here, the total 24-hour acetaminophen dosage should not exceed 3.5 grams. So you should definitely keep that in mind as a pharmacist, just looking at a prescription you might get from a doctor's office. Just make sure it's within that limit of the acetaminophen. Okay, dosage forms and strengths. For the Lortab 5 tablets, there's 5 milligrams of hydrocodone and there's 300 milligrams of acetaminophen. For the Lortab 7.5 tablets, there's 7.5 milligrams of hydrocodone and 300 milligrams of the acetaminophen. For the Lortab 10 tablets, 10 milligrams hydrocodone and 300 milligrams of acetaminophen. And then for the Lortab elixir, or basically the syrup form of this medication, there's 7.5 milligrams of hydrocodone and 300 milligrams of acetaminophen, and that is per every 15 milliliters of that liquid. For Vicodin tablets, there is 5 milligrams of hydrocodone and 300 milligrams of acetaminophen. And then for Vicodin extra strength tablets, there is 7.5 milligrams of hydrocodone and 300 milligrams of acetaminophen. For Vicodin HP, there is 10 milligrams of hydrocodone and 300 milligrams of acetaminophen. And then for Norco 5-325, this one's pretty straightforward. There's 5 milligrams of hydrocodone and 325 milligrams of acetaminophen. And then for Norco 7.5-325, again, kind of the same story. There's 7.5 milligrams of hydrocodone and 325 milligrams of acetaminophen. And then the last strength is Norco 10-325. And again, same story here, 10 milligrams of hydrocodone and 325 milligrams of acetaminophen. Next drug here is lisinopril. For indications, treatment of hypertension. It's an adjunctive therapy and management of congestive heart failure who are not responding adequately to diuretics and digitalis. When initiating treatment, give under medical observation, especially in patients with low blood pressure. The mean peak blood pressure lowering occurs 6 to 8 hours after dosing. Continue observation until blood pressure is stable. Reduce Diuretic dose to minimize hypovolemia or hypotension, which means below normal blood volume or below normal blood pressure. So just pay attention to that. And treatment of hemodynamically unstable patients within 24 hours of acute myocardial infarction. Dosage forms and strengths. This one's pretty easy. There's just tablets, and they have 2.5 milligram, 5 milligram, 10 milligram, 20 milligram, 30 milligram, and 40 milligram. For omeprazole, the indications are short-term treatment of active duodenal ulcer, short-term treatment of erosive esophagitis or poorly responsive gastroesophageal reflux disease, pathological hypersecretory conditions, and then it names a few specific syndromes here. Zollinger-Ellison syndrome, multiple endocrine adenomas, and systemic mastocytosis. Also maintenance therapy of healing erosive esophagitis to maintain the healing of erosive esophagitis and gastric ulcers. Treatment of gastroesophageal reflux disease, or GERD, and other acid-related disorders, and adjunct in treatment of H. pylori infection. Dosage forms and strengths. Capsules in the sustained release are available in 10 milligram, 20 milligram, and 40 milligrams. Also available over the counter in 20 milligrams, which is a non-prescription formula. Amlodipine benzoate. Indications for this include treatment of hypertension and treatment of chronic stable or vasospastic angina. Dosage forms and strengths include just the tablets, so again, pretty simple to remember, 2.5, 5, and 10. Simvastatin. The indications are as adjunct to diet for reduction of total or elevated total and LDL cholesterol, ApoB and triglyceride levels, and to increase HDL cholesterol in patients with primary hypercholesteremia and mixed dyslipidemia, treatment of hypertriglyceridemia, and treatment of dysbeta-lipoproteinemia. Wow, that was a mouthful. To lower total LDL cholesterol in patients with homozygous familial hypercholesteremia, and as an adjunct to diet to reduce total CLC, and ApoB levels in boys and girls at least 1 year past puberty. And it goes pretty in depth with that, so I'm not really sure how far in depth we're going to need to know that information, so I'll just kind of leave it at that. Dosage forms and strengths. Tablets, again, just for this one. 5 milligram, 10 milligram, 20 milligram, 40 milligram, and 80 milligram. For metformin hydrochloride, indications are used as an adjunct to diet to lower blood glucose in patients with non-insulin dependent diabetes mellitus. Can be used concomitantly with a sulfonylurea when diet and metformin or a sulfonylurea alone do not result in adequate glycemic control, and there's no transition period needed when transferring patients from most oral hypoglycemic agents due to the long half-life. So if someone does miss their dose with this medication, it's nothing to be super concerned about. Unlike insulin is very important to get your dose on time, so that's kind of the benefit of this medication, is that it does have a long half-life. Dosage forms and strengths. For tablets, there's 500 milligram, 850 milligram, and 1000 milligram. For tablets extended release, there's 500 milligram, 750 milligram, and 1000 milligram. And then for the oral solution, it's 500 milligrams per 5 milliliters, and that is also known as the Riomet. So you might see that under the brand name Riomet. This oral solution will also be kept in the fridge in the pharmacy, just so you know. Furosemide. FDA indications are Treatment of edema-associated congestive heart failure, cirrhosis of the liver, and renal disease, including nephrotic syndrome. Treatment of hypertension, which is oral only, or acute pulmonary edema, which is available IV only. For dosage forms and strengths, for tablets, there's 20 milligram, 40 milligram, and 80 milligram. For the oral solution, there's 10 milligram per milliliter and 40 milligram per 5 milliliter. For injection, there's 10 milligram per milliliter. For albuterol sulfate inhalation, indications are relief of bronchospasm in patients with reversible obstructive airway disease, maintenance to prevent exacerbations of bronchospasms, prevention of exercise-induced bronchospasm. So this is kind of known as a rescue inhaler. So it shouldn't be used as a long-term maintenance inhaler. You'll be seeing this used more in people that have, exercise-induced asthma potentially. Dosage forms and strengths. For the HFA inhaler, there's 90 micrograms albuterol sulfate per spray. For powder inhaler, also known as the ProAir RespiClick, there is 90 microgram albuterol sulfate per spray, and there are 200 inhalations within that. For the solution for inhalation, this is not AB rated with the HFA inhaler, so although it has the same active drug in it, it is not considered to be 100% equivalent with the inhaler. This solution for inhalation would be used in a nebulizer or breathing machine. So here are the different doses available. There's 0.5% concentrated and 0.63 milligram per 3 ml or milliliter, 1.25 milligram per 3 ml, and 2.5 milligram per 3 ml, and that is unit dose. For gabapentin, indications are as an adjunctive therapy in the treatment of partial seizures with and without secondary generalization in adults with epilepsy, adult dosage adjustments with differences in creatine clearance, as adjunctive therapy in the treatment of partial seizures in pediatric patients 3 to 12 years, and treatment of post-therapeutic neuralgia in adults. Dosage forms and strengths. Capsules are available in 100 milligram, 300 milligram, and 400 milligram. Tablets are available in 600 milligram and 800 milligram. Tablets extended release, which is also known as Grelease, and you can kind of remember that because Grelease rhymes with release, so you can remember Grelease is the extended release. Okay, there's only 300 milligram and 600 milligram for that. And then for the oral solution, 250 milligrams per 5 ml, and this will be stored in the refrigerator. For atorvastatin calcium, indications are as an adjunct to diet to reduce elevated total cholesterol, LDL-C, ApoB, and triglyceride levels, and to increase HDL-C levels in patients with primary hypercholesteremia, reduce the risk of non-fatal myocardial infarction, fatal and non-fatal stroke, angina, revascularization procedures, and hospitalization for congestive heart failure in patients with clinically evident coronary heart disease, to reduce total cholesterol and LDL-C in patients with homozygous familial hypercholesteremia, and as an adjunct to other lipid-lowering treatments. And then it goes on to say that it can be used in boys and postmenarchal girls 10 to 17 years of age with heterozygous familial hypercholesteremia after they've tried diet therapies and things like that. Dosage forms for this include 10 milligram, 20 milligram, 40 milligram, and 80 milligram. For hydrochlorothiazide, indications include adjunctive therapy in edema associated with congestive heart failure, hepatic cirrhosis, corticosteroid and estrogen therapy, or various forms of renal dysfunction. It is used as controlling of the hypertension, and it can be prescribed to children. Dosage forms and strengths. For capsules, it's only available in 12.5 milligram. For tablets, it's available in 12.5 milligram, 25 milligram, and 50 milligram. For alprazolam, indications are management of anxiety disorders or for short-term relief of the symptoms of anxiety or anxiety-associated depressive states. That is the immediate release tablet. It is used for treatment of panic disorder, again utilizing that immediate release tablet, and treatment of panic disorder with or without agoraphobia, extended release tablets for that. And treatment should not end abruptly, so do beware of that. Dosage forms and strengths. For tablets, the immediate release, there's 0.25 milligram, 0.5 milligram, 1 milligram, and 2 milligram. For tablets, extended release, there's 0.5 milligram, 1 milligram, 2 milligram, and 3 milligram. For tablets, orally disintegrating, there's 0.25 milligram, 0.5 milligram, 1 milligram, and 2 milligram. And then for oral solution concentrate, 1 milligram per milliliter. For metoprolol tartrate, indications, the main one, obviously, management of hypertension. Dosage forms and strengths available. For tablets, 25 milligram, 50 milligram, and 100 milligram. For injection, 5 milligram per 5 milliliters. Citalopram hydrobromide. Indications are for the treatment of depression, and it gives specifics on the dosing here. It says gradually increase the dose. The full antidepressant effect may not be seen until 4 weeks of treatment has passed. At least 14 days should elapse between the discontinuation of a monoamine oxidase inhibitor and the start of citalopram. For dosage forms and strengths, it's available as tablet, 10 milligram, 20 milligram, and 40 milligram, and as a solution, 10 milligram per 5 milliliters. For metoprolol succinate, FDA indications are management of hypertension, long-term treatment of angina pectoris, and dosage forms and strengths. Tablets, extended release. So we have 25 milligram, 50 milligram, 100 milligram, and 200 milligram. And these are extended release, so they're only given once a day versus metoprolol tartrate, which is twice a day. Tramadol hydrochloride. FDA indications are for the management of moderately to severe pain, or moderately severe pain, and that is the immediate release tablet. And then for the management of moderately severe pain in patients who require around-the-clock treatment for an extended period of time, and those are the extended release tablets. Dosage forms and strengths include tablets orally disintegrating, also known as the Rybix brand, so that's where you'll see that Rybix brand. 50 milligrams available in that. For tablets, or the Ultram brand, just remember there's 50 milligrams available there. And then for tablets extended release, there's Ultram ER, and that's available in 100, 200, and 300 milligram strengths. For azithromycin dihydrate, indications include mild to moderate infections of the lower and upper respiratory tract and skin structure caused by susceptible strains of H. influenzae, M. catarrhalis, S. pneumoniae, S. pyogenes, S. aureus, and S. agalactae. Sorry if I mispronounced that. Those are just different types of bacteria. Treatment of acute bacterial sinusitis due to H. influenzae, M. catarrhalis, or S. pneumoniae. And you will also see this one occasionally used for STDs, especially if it's 2 of the 500 milligram tablets. just as an FYI. For dosage forms and strengths, tablets are 250 milligram, 500 milligram, and 600 milligram. And just as a side note, a Z-pack contains 6 250 milligram tablets, and a tri-pack contains 3 500 milligram tablets. For the packets, each packet contains 1 gram following reconstitution, so that means it'll contain 1 gram of medication once you've added in the water, just to reconstitute it into a suspension. For the Z-Max powder of suspension, or for suspension I should say, 2 grams of azithromycin, extended release. Powder for suspension, 300 milligrams, that is 100 milligrams per 5 milliliters. 600 milligram, 900 milligram, and 1,200 milligram, each containing 200 milligrams per every 5 milliliter. Powder for injection, each vial contains 500 milligrams azithromycin in a lyophilized form. Losartan potassium. Indications are treatment of hypertension and to reduce the risk of stroke in patients with hypertension and left ventricular hypertrophy. For the treatment of diabetic neuropathy with an elevated serum creatine and proteinuria in patients with type 2 diabetes and hypertension. Dosage forms and strengths, just tablets on this one, 25, 50, and 100, so pretty easy there. Amoxicillin trihydrate. Indications on this one include infections due to susceptible strains of the following gram-negative organisms: H. influenzae, E. coli, P. mirabilis, and N. gonorrhoeae, also indicated in certain infections caused by susceptible strains of the following gram-positive organisms: streptococci, including S. faecalis, non-penicillinase producing staphylococci, and D. pneumoniae. Gonorrhea and acute uncomplicated urethral and anogenital infections due to N. gonorrhoeae, so again, used sometimes for those STDs. Dosage forms and strengths, just tablets, chewable, 125 and 250 milligram. For the regular tablets, non-chewable, 500 milligram and 875 milligram. For the tablets extended release, also known as the Moxitog brand, there's 775 milligrams. And for capsules, 250 milligrams and 500 milligrams. And then powder for oral suspension, there's 125 milligrams per 5 milliliters, 200 milligrams per 5 milliliters, 250 milligrams per 5 milliliters, and 400 milligrams per 5 milliliters after reconstitution. That's why it's really important to make sure any powder for oral suspension is reconstituted before it leaves the pharmacy, because if someone picks up that medication for their kid and they've never used it before, they might just think that they need to just give the powder to the kid, and they might not understand that, you know, it needs to be reconstituted. So we all at Lewis always put stickers on medications like this, just to remind technicians and cashiers that the medication needs to be reconstituted before it leaves the pharmacy. Okay, next medication here, montelukast sodium. Indications are for the prophylaxis and chronic treatment of asthma in adult and children 2 years of age and older, for the relief of symptoms of seasonal allergic rhinitis for adults and children aged 2 and older, and perennial allergic rhinitis in adults and pediatric patients 6 months of age and older, and then for the prevention of exercise-induced bronchoconstriction in patients 15 years of age and older. Dosage forms and strengths include chewable tablets, 4 milligrams and 5 milligrams, tablets just regular 10 milligrams, granules 4 milligram per foil packet. For ibuprofen, indications include mild to moderate pain and primary dysmenorrhea. rheumatoid arthritis and osteoarthritis, including flare-ups of chronic disease, and juvenile arthritis. Dosage forms and strengths include tablets 400 mg, 600 mg, and 800 mg. It's also available in non-prescription formulations containing 200 mg ibuprofen and in various non-prescription liquid and chewable forms for use in children. Prednisone indications include treatment of various allergic and inflammatory diseases of the body. Dosage forms and strengths for tablets, there's 1 mg, 5 mg, 10 mg, 20 mg, and 50 mg. For solution, there is 5 mg per 5 milliliter, and in Tenzol solution, 5 mg per milliliter. Sertraline hydrochloride indications: treatment of depression and obsessive compulsive disorder, treatment of panic disorder with or without agoraphobia and post-traumatic stress disorder, treatment of premenstrual dysphoric disorder, treatment of social anxiety disorder. For dosage forms and strengths, for tablets, there's 25 mg, 50 mg, and 100 mg. And for the oral concentrate, there's 20 mg per milliliter with 12% of alcohol present. For clonazepam, FDA indications: treatment of Lennox-Gastaut syndrome, petit mal variant, akinetic and myoclonic seizures, and in patients with absence seizures, petit mal, who have failed to respond to succinimides. Dosage forms and strengths: for tablets, there's 0.5 mg, 1 mg, and 2 mg. For tablets orally disintegrating, there's 0.125 mg, 0.25 mg, 0.5 mg, 1 mg, and 2 mg.